a great panel today that's with us, and I'm going to start recording now because I do want to be able to share this with others who weren't here today. So we're going to first ask our first panelist, Ruby Brown Jackson, to come up. And Ruby is a former alumni of our leadership class. Actually, she was one of our top fundraisers in 2020 last year during the pandemic. And we got to know Ruby through that. And actually, I believe Kimberly Jackson might have been our chair this year, might have been the one that recruited Ruby originally to be in our into our leadership class. So I'm again just delighted for Ruby to be here and to share her journey with you. So with that, I'm going to turn it over to Ruby.
Well, good afternoon, everyone. I am delighted to be here, and I hope my internet is going to cooperate. I know the weather is getting ready to get a little iffy, and with that, my internet is unreliable. But very excited to be here, very excited to share a little bit about my background and my story and what kind of drew me to this initiative. And yes, Andy, you are right. Kimberly was the person who recruited me. And at the time, I don't think she fully understood what it meant for me personally, and also just what the experience did for me. And so I'll just start with sharing a little bit about myself. Ruby Jackson, I serve as counsel for Southern Power Company. And I know I've got some colleagues on the line, and I'm excited that you all are participating this year as well. So I am originally from Jacksonville, Florida. I moved to Birmingham to attend law school and met my husband in law school and decided to make Birmingham home. And so it was in my last semester of law school that I was diagnosed with MS. And so my experience started with migraines, which of course, being in law school, you just attribute it to stress and just the weight of being in law school, especially being your last semester and looking for employment and all of the good things that come after graduating from law school. And so I just sort of dismissed it. But one day I was walking through what we call the great room, which some of you may be able to visualize at Sanford, and my leg just went numb. And so it was a numbness that I really couldn't explain, almost like I was dragging my leg and had to really work to lift it to walk. And so at that point, I knew something was not right. And so, like many students, I did not have a primary care physician. I actually was going to American Family Care as my source of medical advice. And so I had gone to American Family Care and was explaining, what was going on with my body and my leg issue. And so, of course, they said, well, I think we need to do an MRI. And so I'm thinking, just routine, not really sure why an MRI per se, but certainly agreed to go forward with the MRI. And so it was about 24 hours later after I got the MRI, I got a call from the staff at American Family Care and was told, go to the ER. And I'm thinking, the ER, so what's going on? And so, of course, the nurse on the line, she didn't want to share the details with me over the phone. So she just said, we'll give them a heads up that you're coming and they'll explain everything once you get there. And so I get to the ER and they're like, hi, we were expecting you. We want to run some additional tests. There were some lesions on your MRI result. And at that time, I didn't know what a lesion was, what it meant, or, what they were saying, honestly. It was just sort of a blur to me. And so I go in at Brookwood and I'm there for a week. And they're doing additional MRIs. At the time, they said they would recommend a spinal tap. The first time I got my spinal tap, there was something done incorrectly with my spinal fluid. There's a short window where you're supposed to record something. They didn't do it. And so I had to get 2 spinal taps. It was the worst experience of my life. But after they got the results from my spinal tap, they compared everything. And finally, a neurologist showed up to my room and said, we're looking at everything that all of the test results that we've done on you, and we're thinking that it's consistent with MS. And so at that point, my heart sunk because I didn't know much about MS, but my husband has an aunt who suffers from MS. And so immediately my mind went to her and her condition. And so it was sort of heartbreaking. My mom was still in Florida at the time, and she came up and my stepdad came up and everyone was there with me in the hospital, and we're all just kind of soaking in this information. And so what's the first thing you do when you get something like that, a diagnosis or just anything that you don't know enough about? you go to Google, right? That was the worst thing I could have done. So I'm on Google, and when I tell you there's so many daunting articles and websites and conversations that aren't necessarily productive or helpful for someone who's newly diagnosed with MS. But I'll say I came across the National MS Society website, and from that point, it really changed my outlook on everything, because not only did it share sort of the hard truths about the disease, but it also was a source of resource to kind of give you some comfort around next steps and groups that you could talk to who would share their experience openly. Because at the time that you're first diagnosed, I mean, there's so many things that they throw at you, from you need to consider these medications or therapies. You need to look at, joining a physical group, to exercise regularly. You need to look at diet. And so it was sort of an overload initially, but the National MS Society was certainly my resource in terms of getting everything in line and looking at exactly what I needed to be considering moving forward, including my care. So I started with the neurologist at Brookwood and decided that I needed a better fit, and transferred my membership to a neurologist in Homewood who has been phenomenal. And I mean, I'll share, it's Dr. Reiser's office, and she has what I would call a holistic approach. So in the office, there is sort of a workout room where they offer physical therapy, but just everything you need, I think, to bring you at ease with coping with the disease, and sort of giving you a realistic look at what the outcomes might be, what they might not be, but holding your hand through the process. And so last year, when Kimberly came to me about joining the leadership team and participating, it was really, one, I wholeheartedly supported the organization because I had a personal connection to the organization, and the National MS Society had been a resource for me. But two, MS has been something that I've not really been comfortable with talking about and sharing. And so this was an opportunity for me to be more vocal about the disease, and to just promote awareness around it. I think many people think of MS and they automatically think of, you're going to be in a wheelchair, right? And so just educating people and explaining, that we don't know from day to day how the disease is going to affect us, but staying positive and building the support and relying on research and advancements to help us. That's how we continue to fight. And so groups just like you all is how we make it each day. And so I wanted to participate today just to kind of share with you all that this is important work. And I know you guys probably look at the goal and you might think it's a small drop in the bucket, but every dollar counts. And so personally, I just want to say thank you, Andy and Kim. I thank you for the opportunity to share my story. And I just look forward to staying engaged. So any way that I may be of assistance to you all, please don't hesitate to reach out. I'll say it was a little scary agreeing to do a fundraiser during COVID, but really they give you all of the resources. Bonnie was great. I mean, everything you need, from setting up your page to just ensuring that it's getting that tracking that you need, or traction, should I say, that you need to keep the momentum going during the campaign, was very helpful. So you really have all you need to be successful. But if there's any way that I can help you, please do not hesitate to reach out to me. And so with that, I'll turn it back over to you, Andy.
Ruby, wow, thank you so much for being here and sharing that story and talking about your diagnosis and kind of, just the power of positive thinking and how, Dr. Reiser's office, I know you talked about a lot about how they're just realistic with you, and that helps you to take a good stance every day as you overcome, some days are better than others, and the challenges that do come with MS. And I loved hearing about your aunt's diagnosis, and you talked about her condition, and she probably was diagnosed many years ago when there were less treatment options and less things available to diagnose MS, and so there might have been a longer period of time when she was suffering from different things related to her MS symptoms, and that might not have been diagnosed. And with you, it was a more quick diagnosis, and there were so many more therapies available, which speaks to the work that groups like this leadership class do each year in raising funds, because it helps us to advance basic science research that leads to therapies that benefit our patients. So thank you again so much for sharing. Thanks for all you have done in the past to support this campaign in particular, and all you will be doing in the future. I know we're going to keep you engaged, so I'm excited about that, Ruby. Thanks for offering to help our class this year. So thanks for being here, and if please stay on as long as you are able. I know you've got a meeting at 1 o'clock, but we'd love to have you stay on while you're available. So we're going to move on here with our agenda a little bit, and we've got a great speaker lined up here next, and that speaker is Mr. Andy Tunnell. Andy has, and I'm trying to share my screen here with you guys, and I'm having trouble getting to that. There we go. And so Andy has been involved with the society for many years now. He actually was a member of our leadership class and also was our chair of our leadership class in the past. And did a great job chairing our campaign a few years ago, and has recently, in the last 2 years, joined our Alabama, Louisiana, Mississippi Board of Trustees, and is currently serving as our secretary of our board. And so Andy has a personal connection to MS, and he's going to tell you about that now. So with that, I'll turn it over to you, Andy.
Hey, thanks, Andy. I appreciate that introduction. And I really appreciate all the honorees, the work that you're doing. As Andy said, I've been where you are a couple of times, and I really appreciate what you're doing. And as I'm going to, now talk about, I do have a personal connection. And so the work you do, I appreciate it, on a personal level. And my personal connection with MS is my dad. My dad was a longtime sufferer of MS. And, I'd like to kind of use his life to kind of demonstrate a couple of things. The first is just kind of the devastating impacts of MS. And when I say devastating impacts, I need to put that into context. My dad, he got MS, early, and really suffered through MS when there really weren't many treatments. Nowadays, there are so many, positive treatments of MS, and there's been so much success in that regard that, I'm hoping that, that people will no longer be having an experience of MS of the nature of my dad. And just to kind of talk about my dad, when I knew him as a little boy, my dad, seriously, he was the baddest man that I knew. My dad was he was a big, bad Marine. And I don't know if you know me, I'm not a very big man. My dad was much bigger than I am. He's about 6'1", 190, 195. And like I said, he was a Marine, and he would fight anybody, anytime, anywhere. And if you have the time, I can tell you many colorful stories about him, but just kind of give one episode. When he was going through his instruction to be a Marine on Parris Island, he got in a fight. He picked a fight with his drill instructor. And I've never heard of any Marine that would do that. To get in a fight with a Marine drill instructor back in the 60s is pretty close to a death sentence. And that's exactly what my dad did. He fought his drill instructor. And this very same drill instructor ended up getting court-martialed because one day my dad and his squad mates were in line, and one guy was smiling. And this drill instructor knifed the guy's teeth out. He got court-martialed. And sure, he got court-martialed, but that guy still didn't have any teeth. And that's the guy my dad picked a fight with. So he really was, a bad man. And, it's when you're a little boy, a lot of times the little boys will get in this kind of, argument about, my dad could beat up your dad. My dad really could, or at least he would fight anybody. And so that's kind of what I knew my dad is this kind of force of nature. And just watching the effects of MS on somebody that was, that big, that powerful, that athletic, and watching the effects over time. And the type of MS that my dad had, it was a slow, progressive MS, and so it was just kind of this slow, gradual onslaught. And MS is it's a very unusual disease, and it attacks the nervous system, and so different people have different effects. And for my dad, what it did is it destroyed the part of his nerve system that controlled motor functions. And so as he got close to the end of his life, his motor skills were absolutely destroyed. And so he was a paraplegic for, and it's kind of hard to even remember, for at least the last 5 years of his life, and not the last 10 years of his life. And so, you go from somebody that, was the most coordinated, physical, person, to see him being a quadriplegic. And we took care of Dad at home. And so, we really saw the effects, and my mother's an absolute saint for taking care of him the way that she did. And so it really was devastating. And I realized, at the end of his life, I've got 3 kids. My kids never knew my dad in his prime. The only person they knew was the quadriplegic. And just one last aside about my dad. There's a saying that you realize and recognize the nature of somebody, not how they endure the good times, but instead it's how they endure the bad times, how they handle adversity. And I'm proud to say that my dad, he never wavered in his Christian faith. And so it was impressive to watch him, deal with MS the way that he did. But having said that, that's a cross that I don't want anybody else to have to bear. And so I really do appreciate what the MS Society is doing. And so I'd like to segue to use my dad's life as kind of an example of kind of where things are in terms of treatments for the disease. When my dad first started having his problems with the disease back in the 70s and 80s, for the type of progressive MS that he had, there really was no treatment. And so, my dad was fairly desperate. And I'm not going to say that my dad saw a witch doctor, but he did see a German physicist. So there was a German physicist that thought that he had some theories about how to address MS through treatment of, electromagnetic radiation. And so my dad would go to Germany and just these kind of wacky treatments that really, did not prove to be very, efficacious. And so it really was a desperate time. And MS for my dad was also pretty painful. And so he heard that some people were finding that bee stings helped with MS. And so he also got to where we were administering about 35 bee stings a week to him, which I think just kind of goes to demonstrate how desperate we were back then. And, by the last 5 years of his life, the MS Society, and, through the funds that they give, there was an effective treatment for progressive MS, Ocrevus, which we just called Okra. And so that has come out. And that's one thing that it's been really, hopeful and reassuring to me when I got on the board and just saw all the different treatments that are now available. It really is, heartening to see the progress that's being made. And again, that's why I really do appreciate, everything that the honorees are doing here, raising money for these treatments. And they really are meaningful, and we are getting closer to cure. So again, I really do appreciate everything that everyone's doing. And so, Andy, with that, I'll turn it back to you.
Thanks so much, Andy. And that story of your dad is very similar to my grandfather, or it's a similar thread of my grandfather was also in the military and was a serviceman and was diagnosed in the 1950s, and so lived a very long part of his life with progressive MS without any therapies. And you're right about the bee sting therapy. I mean, that was a lot of people thought it was snake oil, but people were utilizing that as one of the only things that they knew to do at that time as an effective treatment option, and many people did benefit from that. And that was again before therapies were achieved by the National MS Society and by our partners that we helped fund with basic science research to deliver those therapies. And so again, I appreciate you sharing that, and I appreciate you talking about your dad's spirit and that he was had a very strong faith, and that helped to guide him through. And I think again that's important that we think about mindfulness with MS. It's not just physical. It's oftentimes it can be mental and spiritual as well. And so I think that's an important message to leave everybody with. So thanks again for being here. Thanks for all you have done again in supporting this campaign in the past as a participant twice and as an honoree, and just all you're doing through our board work as well, Andy. So I appreciate you being here. And with that, we're going to move to our next speaker, and that is Miss Yolanda, or Dr. Yolanda Wheeler. And I always forget that Yolanda now has her PhD, and we're delighted to have Yolanda here with us today. Yolanda works at UAB, and she works with CPOD, and CPOD is a acronym for Center for Pediatric Onset Demyelinating Disease, of which multiple sclerosis is a demyelinating disease, and it does affect a small population of children. And so we are very fortunate here in Birmingham, Alabama, to have an amazing staff and group of healthcare professionals that work at Children's in conjunction with Children's Hospital and UAB and the UAB MS Center to deliver care for pediatric patients who are affected by MS. So with that, Yolanda, I'm going to turn it over to you. And I didn't know if you have a presentation that you would like to share today in Teams, you can do that here, or if you would like me to do that, I can do that for you, but I'll turn it over to you. Yolanda, we cannot hear you or see you.
Oh, great. Okay. I did not prepare a presentation. I started preparing a presentation. I said, you know what? I can do this without a presentation.
That's great. We'll keep your face up on screen for everybody to see as well, but go right ahead.
Okay. So my name is Dr. Yolanda Wheeler. I have a very personal relationship with multiple sclerosis in that I take care of children with multiple sclerosis. Yes, kids do get MS too. I have been saying that for the past 15 years as my career has started and transitioned. Kids do get MS too. It is a rare phenomenon, but it does happen. I started out my journey in 2006, finishing up my master's degree at that time and trying to figure out, okay, I had been a pediatric nurse for 8 years, trying to figure out what my next steps were going to be, and was completing an adolescent medicine traineeship. And through networking, and one of my mentors when I was completing my master's program said, oh, there's this great new opportunity for a multiple sclerosis nurse, for a doctor that's seeking a multiple sclerosis nurse. I didn't know a thing about MS except for that Richard Pryor had multiple sclerosis. And just was intrigued by the new center being formed. The National MS Society at the time was funding 6 centers of excellence across the United States. And there was an application put in by my collaborator, Dr. Jane Ness, and he wanted a nurse. And to be honest with you, we started out with that conversation about diversity and inclusion. And she wanted an African-American nurse because 50% of the pediatric patients in the Southeast are African-American descent. And so she wanted an African-American nurse to be able to communicate with patients regarding research because of all the issues that may have stemmed from African Americans and people of color having difficulty with participating in research initiatives due to the history. And so I said, oh, this is going to be nice and great and exciting. And I decided to accept an offer 6 months before I even graduated and became a nurse practitioner. It was a steep learning curve. I had been, like I said, a nurse practitioner I had been a nurse for 8 years, was learning my role, but also learning about a new disease process and how it affected pediatrics, in particular teens. And so went on, that was 2006. I took on that role. 2007, I completed a distal fellowship to train, and this fellowship was, it derived from an individual that had an adult who had multiple sclerosis, and he saw the benefits of having a nurse on his team as he was came to an end of life, and his family established a foundation and established basically a fellowship for MS nurses. So I became one of the first pediatric nurses to complete this fellowship in a 6-month period. I traveled from Alabama to Boston to Canada to all over the United States, getting in-depth and extensive education regarding the care of multiple sclerosis, But mind you, I had to tweak my educational experience to adapt to those involving pediatric patients and families. I saw over 500 patients in a 6-month period, had extensive training with multidisciplinary teams, and just engulfed myself in the world of MS. And for that, I am so ever grateful. After the fellowship, I came back to clinic full time. The one thing that's great about where I am and in the place that I am at the University of Alabama at Birmingham, there is a children's facility and there's also an adult facility. So I was able to network and work with not only pediatric MS specialists, but also adult MS specialists that would help my patients as they transition into adulthood after having a pediatric diagnosis. So after the fellowship, I engulfed myself into taking care of my patients. Have probably seen over 300 plus patients who have either had an MS diagnosis or some disorder related to multiple sclerosis over the years. I have also been a volunteer with the National MS Society on the local and the national level. I served on the Tanner Foundation board, which was originally for multiple sclerosis, and now it entails other neurological disorders, including ALS and other disorders that affect the neural system. But the one thing that I can say, it's been a delight being in the role of the nurse practitioner, being a healthcare provider in the center. I'm one of few pediatric nurses in the United States that take care of children on a daily basis who are battling the disease called MS. I decided in 2013, after working for a while, that I would go back and seek my doctoral degree and obtain my PhD. Did a qualitative study. A lot of researchers are interested in crunching numbers and getting the statistical aspects of a research project, and I'm one of those individuals that's interested in quality of life and how disease impacts families. And so that was my research interest. That was my research focus when I obtained my PhD. I've recently been involved with several committees regarding the African American experience, as well as the Hispanic experience related to multiple sclerosis. And so I am humbled at this nomination to be one of the honorees for today. I just, my thing is, I feel like a lot of families have been helped, not only in the state of Alabama, but across the United States as a result of the National MS Society's initiatives to meet those individuals who may be in a diverse and an inexclusive in that situation where they may not have that majority, they may not fit in that majority group. And so pediatrics fits in that minority group, it fits in the diversity group, and then we have that African American portion that does not necessarily fit in the trajectory of multiple sclerosis, but is being addressed by the National MS Society. I don't know what else I can say. This is, over the years, I've served as camp co-director. We've hosted a family camp for children with multiple sclerosis and neuromyelitis optica. We've had 12 camps now and served over 250 families across the Southeast to come, and it has been with the help and the aid of the National MS Society and other organizations who have funded those programs for these families that may not necessarily have had an opportunity to participate in an event of this nature. I am so grateful to be able to continue my work as a researcher, continue my work as a clinician through the efforts that have been initiated by the National MS Society.
Thank you so much, Yolanda. That was fantastic. And I mean, you have been involved for a very long time and have done so much to affect positively in the lives of children and their families and their parents who are going along with that, who are learning of that diagnosis for the first time with their children, which is incredibly hard. And having somebody that's got the experience and the expertise that you have there guiding them and helping them along with that journey, I know is critical. And in addition, you're, like you said, you're doing so much else in this space related to some research. I know right now, particularly, you're working on a PCORI project with a researcher down at Auburn University as well. And so just very grateful for not only what you do day to day in the lives of children who are affected by MS, but certainly in our research space and in helping advance our work that strategically the organization is focused on. And you're such a important part of that, Yolanda. So I again appreciate you sharing with everyone today, and again what all you do day to day in your work with patients. So thank you. And we're going to move on now, and we're going to actually come back at the very end and have opportunities to ask questions and answers. So if you have some questions and answers for our presenters today, we will have an opportunity to ask some questions at the very end. So moving on to our next presenter, I'm delighted to introduce Dr. Lori Smith. And Lori serves on our board of trustees currently. Lori's a retired OBGYN. She's been involved with the society for many years now. Was actually a keynote speaker at one of our leadership class events in the past. And is an activist for the organization, has helped us over the past month with a lot of advocacy work on behalf of people living with MS, meeting with our representatives and senators in the state of Alabama, amplifying her voice and certainly the voices of others who are affected by this disease. And so Lori, like I said, sits on our board of trustees currently and has just been an amazing volunteer in many areas. Walk MS, we used to do a campaign in Mountain Brook called Kick MS, which was a kickball tournament that she was heavily involved in. And again, just brings a lot of experience and expertise to our organization through her medical care that she administered when she was a practicing OBGYN. And now she's going to come and share her journey with you guys of living with MS. So with that, I'm going to turn it over to you, Lori.
Thank you so much, Andy. I really appreciate you and all that the society has done on, my journey with MS. My journey started in, 1999, 2000 is when I first started having symptoms. It was during my pregnancy, and so I attributed a lot of it to pregnancy. It was primarily numbness in my lower extremity that was fairly gradual in onset, but I just thought, it's, just related to being pregnant, and so kind of dismissed it. Then I had another episode of numbness. It was a year later, but I was now postpartum, and this time it was affecting my face. And so I knew at that point there was something going on. So I had a chance to talk to one of the neurologists. I was practicing at the time at St. Vincent's Hospital here in Birmingham. And so we went ahead and did an MRI, and then it was shortly after that I was diagnosed with MS. And, it's funny, we all have so many different reactions when you first hear those words, you've been diagnosed with MS. For me, I knew something was wrong. And of course, those of us, when you start learning about a disease, you automatically think, especially in medical school, oh, I have that. I have all those symptoms. And so at the time I was thinking kind of worst case scenario about things like Lou Gehrig's disease or cancer or different things. And so when I got the diagnosis of MS, I was almost relieved in a lot of ways because I at least knew that it meant I could grow old with the disease. Now, I might obviously have some handicaps as a result of that, but I just knew that it wasn't something that would shorten my life expectancy compared to some of the other things that it could have been. So my husband, on the other hand, had a very different reaction. it was, it's devastating news when you first get it because, it's a chronic illness. And at the time, I'm so grateful that my neurologist was help navigate those murky waters of, once you're diagnosed, what to do in terms of therapy. I knew that we wanted to have one more child. So we had a lengthy discussion with the doctor about, the risk of this being passed on, to children, and then decided, and he did say, Lori, you need to understand, you need to start therapy as soon as possible. So you don't delay getting pregnant. Well, God heard him. And so I was already pregnant and didn't even really know it. I laugh, as an OBGYN, you would think I would actually know that, but God knew best. So we were able to get pregnant, and then I had an uneventful pregnancy. I'm so grateful for that. But right after my second son was born, in 2002 is when I started therapy. And I started on an injection called Rebif that I really did well on. And I'm so grateful for that because I was on that for about 6 years, which I found out later that the earlier that you can start therapy, the better in terms of your outcome, especially at the time interferon therapy, which is what we knew the most about regarding. There was another medicine on the market, Copaxone and Avonex, and then Rebif was kind of one of the newer forms of interferon therapy at the time. And so I was on that for about 6 years, but unfortunately started having some side effects with that. And it was during that time that we tried doing a brief holiday. The side effects were things like it was affecting my bone marrow. I was profoundly anemic. And then I also had trouble with some problems with my liver function test where my liver enzymes were elevated. So we took a brief holiday, started back on therapy at a half dose, but I had the same problems. So it was something that I had to kind of recognize that we were going to have to go a different route. During this time, as far as work goes, it's funny, I know as we talk about Ruby, I had the same experience. I didn't want anyone to know that I had MS when I was first diagnosed because I didn't want people to look at me and say, oh, she's the one that has MS. I didn't want that to be what people linked me to. So I just didn't speak about it as much. And then after about a year, now we'd be, 2002, 2003. I thought, I need to at least let the doctors in my group know. And I started sharing that with them, and I just was overwhelmed by their response. And I also realized I could do so much more as an advocate for MS to share with my patients because several of them had MS at the time, and I didn't tell them that I had it. And I started realizing when I started sharing my story, the tremendous impact it had on other people. And so I recognized that it had the exact opposite effect of what I originally had thought. And so that was kind of the stepping stone for me when I started getting more involved with the MS Society, with Walk MS. And I just had such a positive experience through that I really started recognizing I need to get plugged in more. And so that's when I really joined the MS Society as far as, serving on a Walk MS committee, and really started to meet these amazing people that were a part of the MS Society and really understanding more fully all the MS Society has to offer. And I just thought, okay, we need to shout this from the mountaintops. And so that's kind of when my journey really started, more so being able to serve with the MS Society in a host of different ways. And I was so grateful, we did the brief program at the junior high that Andy had mentioned earlier. It was a way to get the kids more involved, and it was a great success. The kids loved it. They would have teams where they'd compete and, of course, raise money. They had team captains, and everybody was responsible for raising money. And the kids loved it, and it just brought so much awareness and people being committed to such a great cause, which always, when you're advocating on behalf of something, what a big difference that makes. And so with that, I started really appreciating more that the MS Society was able to do as far as bringing research funding and different ways, with an MS Navigator program. So now when people are newly diagnosed, they have a contact person they can call that's at the MS Society that helps them navigate exactly how to go through, what they might need as far as with a social worker, and if they have special needs at home because of mobility issues or different things, related to medical therapy, and they can help advocate on behalf of that. And of course, the medicines for MS are so overwhelmingly expensive. So, I mean, my therapy runs, gosh, almost $10,000 a month. And I'm so grateful to have someone who can help navigate that for me, to help make sure that I have the right insurance coverage and proper funding to help pay for that. So as time went by, I started recognizing that I was having some challenges related to work. It started more with cognition. I don't think I really appreciated that as much, but some memory loss and more difficulty multitasking. A lot of times you attribute that to age, but it was more of a challenge for me. And then I started losing more function in my dominant hand with surgical instruments, or using the bulb to suction when a baby was born, or, placing the cord clamp. I was losing my strength, and I didn't fully appreciate that. At the time, I gave up my OB practice first, thinking I could still do GYN, but realizing that I now was having challenges in the operating room. So I was planning to just do more annual exams and just do office gynecology. But the realization, that I was starting to have a lot more numbness in my fingers, and I didn't want to miss a breast lump or an abnormal exam. And I recognized then that I was going to have to retire completely from practice. So it was, at the time, obviously it's something you worked so hard for. My whole life I had, been working towards the goal of becoming a physician, and loved what I did. But I realized God had a plan for me, and it was through my faith that I just totally trusted that God had that plan for me and would set my feet on that path. And so I didn't look back. I just trusted that he would guide me. And so with that said, I started recognizing I can be an advocate. I can speak out more, have a voice to help. And so I got a lot more involved with the MS Society through different speaking engagements, started serving as an MS activist, which I've come to appreciate, how essential that is, to be able to go to Capitol Hill. We call it Storming the Hill. And the public policy conference that the MS Society does is phenomenal. And they have a great, MS advocates from across the nation. There's about 800 of us, and we just had our recent public policy conference just a couple of weeks ago, and we get the chance to meet you. There's different things we're advocating for on behalf of the MS Society. This year, it's all about telehealth, and then the research program that's done through the MS Society specifically that helps look at newer studies that, there's the traditional studies through the NIH that simply just take a lot more time, but through the research program, it's ways that we can kind of be at the forefront of funding these different studies that really are targeting more MS therapies. You have a lot more involvement with MS patients in the criteria that help determine some of that, what those needs specifically are, and can really fund more aggressively things that are really helping on behalf of the MS Society and patients living with MS. So we've gone from, back when Andy's dad had no options for medical treatment to, just 25 short years ago, we started having more therapies, recognizing some of these. And now today we have over 20 therapies with so many more things on the horizon. When you look at, right now it's primarily disease modifying therapy. So it modulates your immune system in a way that suppresses it. So your body's not really attacking the myelin as much as a result. But these newer therapies that they're investigating are looking at ways to really restore myelin, which would be such a blessing because that means restoring function as well. So we really are on the cusp of ways to cure MS, and then also detect disease early in patients when it's still, there's biomarkers or different things that may show up on a scan, especially for those patients at risk, and you can diagnose them well before they ever have any symptoms or loss of function. Unfortunately, once you have loss of function, you can't restore that. So the goal is the earlier, the better when it comes to diagnosis. So we're advocating on behalf of that and really hoping to be able to, with the help of the MS Society, cure this disease one day. So thank you for letting me share my story and just share a little bit about what has been so impactful for me on my journey and with the MS Society's help as well.
Well, Lori, thank you for sharing your story with us, because that is incredibly impactful for us to hear your journey, what you have gone through, and again, your perspective as a medical professional. You understand the physiology of the disease very well, and do an excellent job explaining it to individuals, and particularly talking about the different therapies that were available when you first were diagnosed versus now. And then at the very end of your comments there, you were talking about the cure. And, for the MS Society has been very, I don't want to say hesitant, but we've been very careful not to use that word until recently. And we are actually about to roll out our new strategic plan for fiscal year 2022 through 2024. Obviously, at the end of this year, our fiscal year starts on October 1st. And that new strategic plan utilizes the word cure. And we really feel like we are on the cusp of breakthroughs that will ultimately lead to that cure. And so I really appreciated you weaving that in at the end, because that's where we're headed. That's the future state of the MS Society. And so I want to say, again, because of work that you have done through our, you talked about Walk MS a little bit, and the Kick MS. I mean, again, we are on the cusp, and so the importance of this class continuing that momentum and progress through its fundraising efforts, I think it ties it all nicely together. So, Lori, again, thank you so much for being here and sharing your story with us. It was really great, and we're going to move on to our next guest, which is Mr. Jonas Booker. Jonas is actually an alumni of the leadership class as well. And sat in the class, I think, about 5 or 6 years ago, maybe even a little bit longer than that. And Jonas is one of our top fundraisers. He's been involved with our Birmingham Community Council over the years. And Jonas actually comes to us. His mom came to us from Mississippi, and so we're obviously the Alabama, Louisiana, Mississippi chapter. So his family has some familiarity with our other state territories. And just delighted for Jonas to be here today to share a little bit about his family's journey, his mom's journey, living with MS. So with that, I'm going to turn it over to you, Jonas. Thanks again.
Thanks, Andy. I appreciate you inviting me here to speak in front of the people here today. Thanks, Laura, for telling your story. I was able to catch half of that when I joined. It's awesome. It's similar to my mom's story, actually. Like Andy said, I'm originally from Grenada, Mississippi. It's a very small town, about in between Jackson, Mississippi to the south and Memphis, Tennessee to the north. And my mother, I think the first time that we knew something was wrong with her, because we didn't know for a long time what was wrong, it was about 2001. I was in college at the time, and she was suffering from what we thought was vertigo. So she had a lot of mobility issues. She always complained about being dizzy. And so she and my dad went to doctor after doctor around Grenada, and then ventured out to Memphis, Oxford, Mississippi, Jackson, Mississippi, till finally in about 2003, somebody had the idea that maybe she has multiple sclerosis. And so they ran tests and scans, and sure enough, she had nodes on her spinal, up and down her spinal column, that are associated with MS. And so immediately, thankfully, they were able to spot that and start her on rebuild therapy, like Lori mentioned. And that's turned out to be a very, very good drug for her to be on regularly. And she actually regained her mobility somewhat to the point where she was, able to be active. She did have to quit her job because she worked as a teller at a cable company at the time of her illness, and she wasn't able to do that anymore. So she went on long-term disability, but she was able to have a good functioning life for years. And then life started happening, or bad things in life started happening, maybe like 5-6 years ago, when my dad started having issues with diabetes. He developed neuropathy and developed having strokes. And so his health started failing. And my mom and dad are really close. They are the rock solid couple, and I commend them for that. They were married for over 30 years until my dad passed away. But leading into my dad passing away, my mom just went all in and cared for him, and let her own treatment kind of fall by the wayside, where she wasn't taking care of herself. And that started to show up issues started to resurface. Her memory loss, eyesight started to fade. A host of other ailments started to happen, and I eventually found out that she was no longer taking a Rebuff. And try to make a long story short, my baby brother passed away recently, and back in October of 2019. But dealing with that and the unexpected death with him living with her really took a toll on her, and she blamed herself. She really stopped really taking care of herself tremendously at that point. And last summer, my dad passed away through complications with the diabetes. So all of that rolled into her just basically being depressed. And it got to the point this past December where she started having a health crisis. And so I went and picked her up and finally convinced her to come stay with me for a little while to just get some things under control, see some better doctors here in Alabama. Like I said, she's from Grenada, small town, not very many healthcare options there. And slowly but surely, she started coming around, seeing her grandson here with me, kind of picked up her mood. She was able to get back on track on her medications. We started rebuilding injections, and we got through the health crisis together. And it was without the help of MS Navigator, helping us navigate through some of the things like depression, getting us in contact with doctors and specialists to see here and back over in Mississippi when she returned. We probably wouldn't have saw the light at the end of the tunnel. So that was very, very fortunate, very, very helpful. And I asked her last week when I was driving her back to Mississippi, hey, I'm speaking in an engagement for the MS Society coming up here. It's called Heart of MS. Is there anything on your journey that you want me to share? And she, without hesitation, she said, do not stop your medications. It's like, that was probably the worst thing she could ever have done, because like we all know, there's no cure for MS. There's only treatment to stop the progression of it. And once it progresses to you can't regain what you've lost. So she wanted me to hit that key point. And with that, I'll wrap up my talk, and I'll say that my mom is doing okay, and we are continuing our journey through MS. We're continuing to fight MS by partnering with the MS Society. Like Andy mentioned, I'm part of the advisory council. I served on the MS leadership class back in 2017. I was happy to do so, happy to help raise funds to benefit those like my mother and others who are suffering through this terrible, terrible disease. And so I greatly appreciate you all's efforts this year's class in trying to raise funds, raise awareness, being aware yourselves of the condition, and those who you may not know now, but soon in the future may have also been impacted by this disease. So with that, I'll turn it back over to Andy. Thank you, Andy.
Jonas, thank you. And, a couple things there related to your mom's journey. I think when she was diagnosed originally in Grenada, I think that we have made a lot of strides related to healthcare access and identifying, particularly community neurologists that can help with MS and educating those community neurologists about what multiple sclerosis is. So individuals like your mom who may be in a more rural community do have access to good care. And then certainly those community neurologists, through their education and learnings, are then able to refer them to MS specialists in larger, more urban centers like Jackson, Mississippi, Memphis. I know you mentioned, and then again in Birmingham when she's been here recently. So, again, I think we've made a lot of progress since she was first diagnosed in that area. And then I also want to thank you for mentioning our MS Navigator program, because that is really one of our key services that we provide for people living with MS and their family members and caregivers, people who care for those living with MS. And like you said, they're a resource. They're a level of support. In the case of your mom, it was depression. She needed someone to maybe talk through that a little bit. more in depth. These people are highly trained. They're almost social workers in terms of their skill level and communication skills. And so helping your mom through that aspect of her disease, which is not uncommon. Depression is very common with MS, and particularly when it's coupled with a passing of a loved one. And then certainly also in addition, the navigators can really refer people to clinicians and physicians that can help them where they are located. And so there's no really physical boundary for our navigators. They have all of the information at their fingertips and are able to then connect our clients and families with local resources that are able to help them move through their journey with MS. So I really appreciate you recognizing that and speaking to that today, because that is a cornerstone of who the National MS Society is and how we deliver services for people affected by MS today. So Jonas, again, thank you so much for sharing that and being very honest about your mom and your family's journey with us today. And I know it's been a challenging 6 to 8 months, and I'm glad to hear that your mom's in a better place now and is back on her medication and is doing well. So thanks again for being here today. And we're going to move on to our final guest today. And we saved Rob Motl for last. Dr. Motl is actually a lot of this, what we've talked about leading up to Dr. Motl kind of feeds into him nicely, because Dr. Motl is the MS researcher, and he is funded by the National MS Society and is doing some really remarkable work here in Birmingham, and really has been doing work in this space for many years. And it's specific to physical activity and exercise and wellness of individuals living with MS. So I don't want to steal too much of Dr. Motl's thunder, but I certainly appreciate all he does here in our community and to engage people with MS in his research studies. So with that, I will turn the presentation over to Rob and let him have the next 10 to 15 minutes to speak.
Great. Thank you, Andy. I really appreciate the opportunity to speak as part of the Heart of MS program. I do want to disclose that I'm on the Lakeshore campus right now, and it is thundering and lightning here. If I lose power, I will lose connection. So if that happens, I apologize. I want to start with my disclosures and my story. I don't have MS. I don't have a family member with multiple sclerosis. So that really should kind of make you wonder why I'm here and why I do what I do. And I will tell you that I live and exist for research in multiple sclerosis. Somehow, some way, I was given a gift to do research, and somehow, in some way, that gift found its way to multiple sclerosis, and it has changed my life. It's changed my life in unmeasurable and innumerable ways, and research in MS really has become a large part of my life. I spend the majority of every single day thinking about MS and thinking about the research we do and thinking about how we can design new research trials to try to change the face of multiple sclerosis. My life and my story on exercise and MS research started almost 20 years ago when I started my career as a professor at the University of Illinois. I just graduated with my PhD and completed a postdoctoral fellowship at the University of Georgia, and that's right, go Dogs. And I somehow landed at the University of Illinois, and I was asked every single day about the clinical relevance of the research I was doing. And I just happened one day to read an article on a drug called baclofen and its effects on spasticity in people with multiple sclerosis. And the research was so aligned with what I was doing on exercise and the mechanisms that they were studying that the two just came together in synergy. And I applied for a grant to the National MS Society. They funded it, and I've never looked back. I spent 15 years at the University of Illinois before I came to the University of Alabama at Birmingham. At the University of Alabama at Birmingham, I'm a professor and director of research in the Department of Physical Therapy within the School of Health Professions. And I also serve on many leadership roles across campus, such as the University Center for Exercise Medicine, the Nutrition Obesity Research Center, as well as the UAB MS Center. one of the things I do is I direct what's called the Exercise Neuroscience Research Lab. Our lab is located on the Lakeshore campus in Homewood. Our research is really designed around looking at exercise and the effects on the central nervous system or manifestations of problems within the central nervous system. Our research really focuses about 90% on people with multiple sclerosis. We spend a little bit of our time working on Parkinson's disease, more recently some rheumatic diseases and conditions, but the majority of what we do is in multiple sclerosis. And our mission is really changing the lives of persons living with multiple sclerosis through the study of health behaviors, particularly exercise, but we're beginning to understand how to combine exercise with other treatments such as nutrition and diet, or exercise and cognitive rehabilitation as combined treatments to target problems in multiple sclerosis. We have lots of ongoing research projects. And I don't want to spend a terrible amount of time talking about each one, because I want to talk with you in a moment about some new projects. But one of the projects we have is funded by the National MS Society. It's called HALT MS. And HALT MS is really an acronym for Healthy Aging Through Lifestyle and Multiple Sclerosis. And it's a grant that is designed to pull together researchers on the UAB campus who either study aging or they study multiple sclerosis or something relevant to aging or multiple sclerosis, and pulling them in to expand the number of researchers doing work in this area. And as an example, we just pulled in a woman by the name of Laura Rogers. And Laura Rogers is a professor and medical doctor in preventive medicine who studies the effects of exercise on the gut microbiome of breast cancer survivors. And I had a meeting with Laura, and we chatted about her research and decided that we should do a similar project in people with multiple sclerosis to look at how we might study the effects of exercise and diet on the microbiome in people with multiple sclerosis as maybe a new mechanism for treating fatigue and other problems such as depression, as Jonas had mentioned earlier. So that's part of the HALT Center. We have what's called a mentor-based postdoctoral fellowship, where the society has given us money to fund a postdoctoral fellow. This is an individual who's completed their PhD, and they want advanced training. And they specifically want advanced training in physical activity promotion. And so we recruit these individuals from all over the world. So the current fellow is actually an Iranian, an individual from Iran who has joined us because we're learning that MS is probably one of the most salient and prevalent neurological diseases in Iran, and we need to begin to study lifestyle behaviors in a different context and how that can affect the disease in that country. But we bring individuals in, we provide them advanced training for 2 years, and then send them out to be the next leaders. Some of our trainees have gone to Johns Hopkins to start their academic career. Other individuals have gone to Stanford University to start their academic careers. So this program has been very successful in kickstarting young researchers and getting them to very prominent places to make impact. And I'm really excited to let you know about 2 brand new projects, and Andy doesn't even know about this, so this is going to be brand new news to him. So we just received notification from the Department of Defense that they are providing us with a $2 million grant to study the effects of exercise training on major depressive disorder in individuals with multiple sclerosis. So major depressive disorder in multiple sclerosis is different than major depressive disorder in the general population. It expresses itself differently, and its responsiveness to treatment is not the same as what we see in the general population. And so we had this idea that we could develop an exercise training program that could target different neurotransmitter systems within the brain that are disrupted in multiple sclerosis as a way of treating major depressive disorder. and having secondary symptoms. So this is a 4-year grant where we will recruit about 150 people from the Birmingham area who will engage in this exercise training program, where we're going to see if we can treat severe, poorly responsive depression in people with major depressive disorder. And this is the first trial that's ever been conducted on exercise and major depressive disorder and MS. So this is really, really exciting and big news. The second thing I want to share is that we just received an award from NIH. We received what's called an R01. An R01 is the largest research grant you can get for an individual study through the National Institutes of Health. And we are taking a study that was funded by the National MS Society to change physical activity behavior and looking at whether we can use that exact same stimulus to reverse cognitive impairment in people who actually present with impaired processing speed with multiple sclerosis. The exciting parts of this study is it's an entirely internet-delivered intervention program. So we can target people from across the United States in any location in the United States, as long as they have access to the internet. The second exciting thing about it is we're actually developed a system to collect neurocognitive data, which is high quality, objective data on cognitive processes, such as how fast you can process information, how well you can learn and retain information for memory, and things along those lines, also through the internet. So we can deliver the highest quality exercise training program and the highest quality outcomes in this new study. And this is a study that will take about 5 years to complete. We plan on enrolling about 320 individuals from across the United States. And this is an award to UAB in the area of about $3 million to do this research. So research is expensive. It is a very, very, very expensive endeavor. And we take the dollars that we receive from any organization and do the highest quality research that we can, so we can ultimately create a body of knowledge to change the lives of individuals with multiple sclerosis. And I'm here because I always make this passionate plea that we need your help. We need your help for more than money, though. You know, that's only a small part of this. We need your help because you guys have passion, you have commitment, you have outreach, you have a network. And we need this so we can extend the impact of what we do in multiple sclerosis. And this is never more important than now, because we're learning that there are over 1 million people diagnosed with multiple sclerosis in the United States who need our help every single day. And it's likely that that number is going to continue to grow. So I would encourage you, I would challenge you, I would really ask you to bring everything you have to engage with this disease, with people who have this disease, with people who are trying to help with this disease, to really help us change the face of the disease. And with that, Andy, I will stop my talk and give you the remainder of the time back.
No, that's great. That's perfect, Rob. And that's exciting news about those 2 new projects that you'll be undertaking. I can't wait to hear more about that. Maybe you and I can carve out some time to meet and discuss that further, but that's really exciting. And I just, again, want to thank you for what you're doing. I think it's really interesting work in the sense of looking at, we talk a lot about disease modifying therapies being medicines, but that your work is really looking more at how can people utilize physical activity, exercise, diet, wellness activities as its own disease modifying therapy in combating MS and the effects of MS and living their best life. And I think that's a really holistically, again, whether it's a combination of those things or one or the other, I think the research that you're doing is really valid and great. And I'm excited that you were here to share that with people today, because I know there are people on the call that are probably very interested in that specific line of research that you're in. So with that, we've got a few minutes left. I do want to open up the floor for any questions. There may be some, there may not be any, and that's okay if they're not. but we do have a couple minutes, and I think most of our panelists are still here. So does anybody, if someone does have a question that's on the call, feel free to just pop up on camera or unmute your mic, and you can ask the question of our panelist. And again, no pressure. If there are no questions, then that is fine. A little pregnant pause here just to give anybody a chance to chime in case they need to. All right. Well, guys, again, I just want to thank everybody for your time today. This was a 2-hour program. Again, the purpose of it was really to give you an opportunity to network with one another at the beginning of the call, get to know one another, your work in the community, what you're doing, not only professionally, but kind of your personal things that you enjoy doing as well. A little fun activity there at the beginning, and then certainly just a great diverse group of speakers. Our six-person panel today. Bringing a lot of perspective to their journeys with MS, their families, members' journeys with MS. But I think it was really powerful, and I hope you all learned a lot today and are going to leave here inspired and take what you learned here over the next month and integrate that into your fundraising activities, into your awareness generating efforts for the MS Society. And as Kimberly started the call and said, if there's anything that she or me or Bonnie or Jenny can do to support you over the next month, that is what we are here for. We want to make you successful. We want you to have a successful campaign, and we want it to be rewarding for you at the end of the day. So again, thank you all for your time today. We will certainly be in touch with some more reminder emails here in the next week or so. You'll be getting some touch points from Bonnie via phone. And then we'll look forward to seeing you on the 11th at the club for our graduation reception. And it'll be a casual event this year, a little bit more casual than what we've done in the past because of COVID protocols, but we will be together. So that is exciting, and we will look forward to seeing you then. Everybody have a great afternoon, good weekend ahead, and we will be in touch. Take care. Bye-bye.